Hello and thank you for joining us on the midweek edition of Journalist Hangout. This week, I'm Ayodele Ozugbakun. Let's continue to intensify the fight against COVID-19 by observing safety regulations as the pandemic spread further across Nigeria. Today on the program, Nigeria records 195 new cases of COVID-19, the highest single-day infections as pandemic spread to more states. I'll be hanging out with Babajide Kolade-Otitoju and Solomon Ajuziogu. So if you're ready, let the hangout start now. Thank you for joining us. It appears we still have a long way to go in taming the scourge of COVID-19 in Nigeria. Exactly a week after witnessing a record 117 confirmed cases of the coronavirus in a day, the country has broken another record. On Tuesday, the Nigerian Center for Disease Control, NCDC, announced that the country recorded 195 new cases of COVID-19, the highest single-day infection so far. The pandemic has also spread to virtually every state in the country, 33 as at the last count, leaving just 3 states yet to be confirmed cases. Now, this is in the wake of a planned ease of the lockdown in Abuja, Lagos, and Ogun State, feeling fear of a spike in number of cases afterward. Let's hear the view of the Deputy Senate President, Senator Ovi Omagege.
That had this challenge and that moved swiftly, like Mr. President did here, to order a lockdown. There was some good containment. But because of these economic hawks, as they are doing here, those some economic hawks now started breathing down on that regional government. And the regional government caved and reopened. And in reopening, it became a premature reopening. Immediately they reopened the economy, there was now a spike, in more infections. So that is my fear. The way and manner the president had gone about it was very, very good. He locked down the epicenters, that is Abuja, Lagos, and the surrounding Ogun State. Frankly, I would have actually preferred if the entire country was locked down at that time. But even though the president didn't do that, but some of the states taking a cue and seeking the same powers for the Quarantine Act also moved to lock down their states. And it was effective. At least it's been effective in containment. But my worry is this. By May 4, it's only 1 week. If you now reopen on May 4, because of this pressure from all these people now, you reopen and we now have a spike. What do we now do? Like the Japanese state now, for instance, after caving, and there was that spike, they had to go back again to order another lockdown for another 3 weeks. So it is like going back to square one.
What would you advise?
My advice would have been they should leave Mr. President alone. Let Mr. President rely solely and exclusively on the advice of is it NCDC, the science people. They know better than us. But my worry is that there are a lot of people who are thinking more of the economics, that are mounting pressure. Relax the lockdown. We still have 1 more week, like the president has done. Let us see if things go down at that time, and then we take it from there. To the extent that there will be a relaxation, I'm hoping should we go ahead with that relaxation, my hope is that some of us, they will take some ideas from us, because the bulk of the challenge we have, as we're told, is that as much as possible, we should not have too many people, in the same place. There should be social distancing. And I think we'll come up with some ideas, like the Federal Civil Service, for instance. All that is required of them is that they work Is it 8 to what? 8 to 5? Yeah, 8 to 4? 8 to 4. Uh-huh. I'm sure we can work out an arrangement where maybe half of the people will work from 8 to 12. They go home. And others will take their place from 12 to 4. So that way we'll be able to work out this social distancing within the office environment. And some other protocols that we can put in place. But I'm very, 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 very concerned that the gains that we made from the presidential lockdown in those 14 days plus this 1 more week, my fear is that I just don't want us to lose those gains. They should let Mr. President alone. He's been doing a terrific job. He should be allowed to rely on the evidence of science, not evidence of money or monetary damage to the economy.
That's Deputy Senate President, Senator Ovie Omagege. Now, Babajide, yesterday wasn't funny at all. This NCDC report wasn't funny. In just one day, 195 new cases. In just one day. Yes. And a lot of people are now of the view that, look, yes, as alluded to by the Deputy Senate President, that people are piling pressure on Mr. President. Open the economy gradually. But a lot of people are saying that, look, somebody even told me that Monday, I'm going to be in my house. I will not step outside that because, look, what's the essence of having the spiking figures and they want to relax the lockdown?
Well, I think the government is not going to relax the lockdown in a manner that puts all the gains that we have made at risk. The president knows that if things collapse, he will be blamed. Those who are playing politics in America, they are heaping all the blame on Trump, as if Trump is the author of the virus. The buck stops at your desk, and the president should realize that some of the people who are advising that the lockdown should be eased are only self-serving. It is only when we have life that we can enjoy the economy. We can decide to put an end to the lockdown in the interest of the economy, and then we will harvest debts. When we harvest debts, even the economy itself will not do well in such a situation, because you will then be distracted. You want to make sure that you put a stop to the hemorrhaging of human lives. So this is the situation. Yes, you can ease the burden on Nigerians, but you need to target only the critical sectors. I'm happy that the CBN has lifted the embargo on check clearing. It has begun to sell dollars to bureau de change operators. That is one critical area, because, for example, those who want to give palliative materials to people, they can't do big money deals because the banks are short. You can't expect someone who wants to buy stuff in excess of 15 million to go and begin to cash the money from an ATM. There are some big money deals that you can only do when you walk into the banking premises and they make the cash available to you, except if you have a semblance of a bank vault inside your house, you know. So this is the situation. We cannot afford to relax the lockdown in a manner that will wipe away all the gains that we have made. Other countries are doing it, and they are doing it in phases. I was talking about the Italians, the Italian PM saying, look, you can now move around, but only within your regions. He knows that if he permits people to move from one region to another, the community transmission will spike. So he said, no, you can only now move around within your region. And he's saying, yes, funerals can resume, but no more than 15 persons can take part in such funerals. And he's saying, now, even football clubs, sports clubs can begin to train as a group. But even that will begin on May 18. So everything is in phases. And the truth is that the Italians have managed this very well. Last Sunday, only 260 persons died. And Spain has already overtaken Italy. There was a time when everybody was talking about Italy, and the Prime Minister said, we can only look up to God for solution to this problem. But they put draconian measures in place. People are very angry. People felt, why? You know, everyone knows them that that's a country where people like to enjoy life. But they put draconian measures in place in peacetime. But the gains, we are beginning to see the gains because they've reached the peak. And they are beginning to flatten the curve. So they, at that point, it makes sense to begin to relax the lockdown, but not even that you are going to do it in one fell swoop. No, nobody will do that. I expect that even when the president, because now the president is saying, okay, manufacturing, they can come in, ICT, you know, people working in the ICT sector, they too can come back. Courier companies can begin to come back. There are some people that we need critically, that we need to get them to return to work. But I'm happy the president has not said, oh, churches and mosques, you can come back. No, ban on gatherings remain. But as I said on Monday, the biggest thing that we need to do is to stop this traveling from one state to another. Honestly, the bulk of the transmission that we are witnessing now, and we don't know, somebody told me that it is in May that we will see the extent of the spread of this virus, that we have not seen anything. That it is in May that we see it. And the bulk of the transmission has happened with people traveling from one state to another.
Now, Solomon, Lagos is number one, the top Nigerian record in the highest single daily infection of COVID-19. And ever since this thing was even discovered in Lagos, you know, it's the same Lagos. I'm afraid.
One of the trends we have observed so far, let me just point out before I go to this trend, is that from the very first day, 27th of February, when we had the first case here in Lagos, it's been 2 months and 2 days down the line, and we're at 1,532. So naturally, that Lagos, being the first place we had the first case, and being the most populated place in the whole of Nigeria, there is something that has to do with population, the rate of reproduction of the virus, and population. There is a relationship. So United States has had a huge number of deaths, not like any other country. Of course, you'll understand that America is a nation of 330 million or thereabout people. So there's something that has to do with population. And Lagos is the most populated place. Lagos was first and foremost the point of egress where the virus came into the country. And of course, Abuja as well. And you have seen that Lagos, Abuja, and Kano have witnessed such massive situations. So it's not unusual, or rather, it shouldn't come as a surprise that with the population of Lagos, with the close proximity of how people live in Lagos, and with, I think, a bit of, at the grassroots, where there is a bit of nonchalant attitude, you know, at the grassroots. You go to the inner streets and you see what's going on there and the way people, and then you also see that as the way the thing is also spreading out of Lagos, as it seemed, is also as a result of the fact that the law enforcement agencies, the police especially, haven't been forthright in enforcing. So it's natural that because of the population here and because of the cluster of people that you have this number of cases in Lagos. But then Kano is something to also look at, because we said the other time that Kano didn't have some cases for a few days or 1 or 2 days, and then testing resumed yesterday, and we see the number going up 38 and all of that. And this is because also we have not done the testing vigorously at the level at which we ought to be doing them. So Jide was just talking about May, as if some people, there's a predictive model that talks about what you would get. I also think there's a relationship between your capacity to test and the number of people you will have. So the thing is, if you are testing 20 people, maybe 5 people, a quarter of that, or thereabout.
But the import of that message is that that thing might have, the spread might have done a large damage.
That's a very critical part of this whole thing that is going on. We are putting in so much effort. We are doing all of that. Somebody is saying, we need to understand the nature of the spread, how it moves. You say, yes, it moves from human to human. How exactly does it move? To the point where we are now saying, okay, there's community transmission. Where did the people get it from? How far have they moved? How have they clustered? How is it easy that at the community level the thing is transmitted the way it is? So first, we need to conduct investigations to understand exactly how this thing moves and the speed at which it moves, so that we can also scale up testing. It's not just enough to be saying we are going to scale up testing. As of today, Nigeria is able to test approximately 2,500. And then we want to test in 3 months, we want to test 2 million. Now that means that we are going to be able to test 22,000 people every day. Every day. Now that's a huge challenge. So how soon can we scale up the testing capacity if the reproduction rate of the virus is this high?
All right, I have Ade calling us from the United Kingdom. Thank you for joining us, Ade.
Thank you. Good afternoon.
Good afternoon.
I want to say well done to all of you. You are doing a very good job. We're enjoying you. Thank you very much. God bless you all.
Thank you.
Just to say quickly, number one, please, all your journalists that goes out, and you microphone, the type we are using now in Europe here, in order to protect saliva interviews to save them for their own security. The longer microphone. If you watch TV in London, you see the journalists using it. Thank you. Then secondly, I'm not happy with the relaxation of this lockdown, because by next month, you are going to see the peak of these things, and it's very deadly. If you can send a journalist, maybe if he tell you his experience, that will make people to understand. It's a serious issue. They shouldn't relax it by this morning. They are relaxing it. I'm very sorry. It's going to cause a lot of problems in Nigeria. So we are praying, but at the same time, action is better. Again, so be careful. They shouldn't relax it at all. Money should come last. Life should come first before the money comes, or economy, or whatever.
Thank you, Ade. Thank you, Ade. Now, Jide, let's look at the economic part of this. No doubt, companies, this thing will be stretching to May. The whole of April is almost useless to 85% of the companies we have in Nigeria. When I'm talking in terms of being useless economically, April wasn't viable. Nobody could manufacture, nobody could do anything, and a lot of people are looking at, if this persists, the consequences, job losses, pay cuts, company filing bankruptcy.
Yeah, it's a very precarious situation that we have found ourselves. And remember, earlier this month, Ashwaju Bola Ahmed Tinubu suggested that the CBN should provide loans, non-interest loans, to businesses as a way of stimulating the economy at this time. He also said that the federal government could consider what he called payroll support. Payroll support, according to Ashwaju Bola Ahmed Tinubu, will help companies that are really not doing well at this time to be able to keep workers, at work, be able to pay their salaries. Because the truth is, you are supposed to eat what you kill. That's what business managers talk about. We are supposed to eat what we kill. But in the situation that we have found ourselves now, we are incapable of eating what we kill. That means, which is like, okay, eat from the money that you make. Pay salaries from the money that you make, from your income. That cannot happen at this time. So that's why Ashwaju was suggesting that there should be payroll support, that the president should consider that so that the critical companies can be kept afloat. It's similar to what Obama did when he came into office in 2008. It was the season of recession, global recession. Some of the American companies, all of those automobile companies in Detroit, they were in trouble. The airlines were in trouble, you know. So he knew that he needed to do something.
Already in this
and
one
then
now,
he
the
reflected,
airlines, they're like the worst hits.
See, and it's not in Nigeria alone. Look at what the CEO of Airbus was saying.
Okay.
He said, we are bleeding cash at an unprecedented speed, which may threaten the very existence of our company. We must act urgently now to reduce our cash out, restore our financial balance, and ultimately to regain our control, the control of our destiny.
We are bleeding cash.
He said
in
we are
an
bleeding
unprecedented speed.
How are you bleeding cash? You have to. You are
not flying.
You are paying the workers.
You are packing.
You are paying the workers. Yet you are not making money. Now, the capacity of those airlines to acquire new planes, because every year they acquire new planes.
Orders.
Yes, you can't acquire new planes. If you place orders initially, you are then forced to cancel those orders because you know that you have not made enough money, you know, in the course of the year to be able to sustain such a big project. So this is the thing. The SMEs, for example, must be supported. Otherwise, because if we do not do that, many companies will die in our country. Many jobs will be lost. Already in America, the quantum of job lost is already a record in that country. We all know that it's impossible to keep people
Before
at
this
work.
COVID-19, it was all-time low.
Yes,
3%,
and America,
4%
the American economy was the best in the world in terms of performance, doing very well. That's to tell you the damage that this virus has done not just to America but to the whole world. You know, so the world must come together to find a vaccine. If we find a vaccine, the vaccine gives you immunity against it. It can no longer
be a
threat to you. Once you are vaccinated, you are safe. It can never infect you again. So that is the best thing. I hear that by September, yes, some of those companies, those pharmaceutical companies will have found a vaccine. They will have done enough trials because all these things take time. But what happens before we get to that threshold?
From now to September.
It's a long time, and many lives will be lost. We are just approaching May. In Nigeria, for example, the way this thing is spreading, we have to
don't even have the capacity.
See the way
to start.
You can see why. Do you know why Lagos? Why is the numbers from Lagos are rising despite the efforts that have been made?
500 beds here,
A
200
lot
beds here.
of the people who came in refused to go to the isolation centers.
Mixed with the
They chose to go to private clinics.
Hospital.
where they went ahead to infect the nurses and doctors who are treating them. Yes. When you hear that Nigeria is losing a lot of health workers to this virus, they are not the health workers on the front line. They are because the ones on the front line, they are properly kitted. They are the health workers in the various private clinics that selfish elites are going to, instead of going to the place where they will be.
And people that lied about their travel.
Of course, that's what you won't even tell them that you traveled because you know they will reject you. But they want to be treated in cozy and highbrow hospitals.
They've affected most of
you know, and those they are the ones who have infected so many people. And then people entering buses, moving from place to place. You can imagine someone who is infected, who confessed that he had to break his journey 3 times. So at every point, he got into the bus with a different set of people. That's how this thing spreads.
I see Lagos now, even when you go around Bega, when you go around the public transport, I see them.
They fill to the brim.
Yes, they've started carrying
and
people.
The government came up. The government came up with. The government came up with these measures. They said your motor parks, you must have places where people can wash their hands. You must have hand sanitizers in your bus. You must not carry more than 60% of your capacity so that people can be properly spaced. But is that what we are seeing? No. The answer is no. And nobody is arresting them.
It's business as usual.
They are packing people, filling their buses to the brim with people.
Even under this lockdown.
This is how this thing spreads. This is how this thing spreads.
Solomon, talking about the implication of this on the economy.
Yeah, first, talking about certain protocols that were put in place for people. Under the lockdown, commercial vehicles are not supposed to move. So for the 4 months, for the 4 weeks that we've had, and then the additional 1 week, commercial vehicles are not permitted. So if you saw a commercial vehicle, a bus, for instance, with passengers, with commuters, on Lekki-Ekpe Express Road, or on Ikorodu Road, or on any other road in Lagos, he must be moving. The driver, the conductor, and the people must have moved about from point to point with active cooperation, complicity of law enforcement agents who should have vigorously brought them to book. Having said that, so it does not matter having hand wash, sanitizers in your park when you're not even running at all. You can only have these if there's no lockdown. In any case, a lot of people have also not been faithful in adhering to lay down medical protocols, hygiene protocols for the virus. A lot of people have not been faithful, and that is where enforcement comes in. You will, when you make rules, you will always have people who are deviant, who are against it, who will run against it, and that is why you have the law. That is why you have enforcement, and you need to vigorously enforce it. If you don't enforce it, then people will keep breaking the rules. So you need to step up enforcement. We have less than 1 week to go now. Then talking about the economy. Now, you will understand the perspective when the Deputy Senate President talked about the things that he talked about people bringing pressure on the President to reopen. Now, the Americans have called on their own reserve to be able to, soften, unemployment issues, pay off, people who are not working and all of that. The first question I ask is, how much can we call into, how much depth do we have in the Treasury to be able to do that? So you will understand how many of the companies will the government be able to take care of in this particular area. So you'll understand that people want to get out to work, because how long can you sustain this? So we need to talk about the strategy to reopen.
Okay, we take this breather to pay some bills. When we come back, we'll discuss more. It's still Journalist Hangout. We'll be right back after this time out. Please don't go away. Thank you for joining us. In case you're just joining us, This is your multi-award winning program, Journalist Hangout. We are reaching you live from Television Continental here in Lagos, Nigeria. And Babajide, one other thing we've been talking about in the last 48 hours is this homegrown solution. We've been talking about Senegal coming up with their test kits. We've been talking about Madagascar. Yes, you know, finding a kind of local solution to this COVID-19.
I think that at this stage, we must look for help wherever we can find it. If that help resides in a Nigerian, then we must go for it. If it resides in an African, we must go for it. We can't place obstacles in the way and begin to imagine that because this cure or the touted cure, because it does not come from Europe and America, therefore we must undermine it. That is wrong. It took an Asian woman to let the world realize that malaria has become much more difficult to handle, and that the world must tackle malaria with a combination of drugs. That's how we had artesunate, the rest of them. So, combination of drugs, because malaria had developed thick skin to the chloroquines and other drugs that the world was using. And eventually, the woman even won a Nobel Prize. So, the solution can come from anywhere. We should not close our minds to help. Anywhere it can come from. I had the boss Mustafa, the SGF, saying today that they are ready to encourage research, let people do research. They are ready to receive help from wherever it can come from. I mean, help is in form of herbal remedy for this kind of, this is a new disease.
Well,
The world had never seen anything like this. So perhaps the solution, the cure, is going to come from Africa. So what has happened in Madagascar, the president, the young president of that country, has backed it wholeheartedly. You can see the approach of the Senegalese. And the figures are very low for Senegal. They're among the best in the world. They are top 3 in the world when it comes to managing this disease.
virus.
So that's an example that we can take.
Okay.
That's an example that we can take. So let our people not imagine that, oh, it has to be Europe and America.
Quickly, let's join Professor Maurice Iwu. Professor Maurice Iwu is joining us via Skype from Owerri in Imo State. Professor Maurice Iwu was the former INEC chairman and is a pharmacologist. I think that's his pharmacologist. That's his first calling.
Yes.
Many thanks for joining us, sir.
Well, I can hear you hardly, but because the network here is very poor, there's a rainfall here, so
Okay.
can you hear me?
Yes, I
Yes,
can
we
hear
can.
you. That's so clear. Now, I want you to tell Nigerians the kind of remedy you've come out with against COVID-19.
I didn't get that. Please say that again.
What's the remedy that you have come up with, sir, in respect of COVID-19?
Frankly, I can't make out the sound. The sound quality is very poor from here. But if from what the last speaker was saying, I agree completely that wherever we can get the help now, that we should be able to do that. What we did in our own part of our own contribution was the fact that coronavirus is not entirely new. That there was a predecessor to it, which is called SARS. SARS stands for Severe Acute Respiratory Syndrome, which happened earlier. The SARS coronavirus was the one which actually the death rate is about 10% of people that actually get the infection die. And this one is technically is SARS coronavirus 2, although we call it COVID-19 because it came out in 2019. So what we are actually surprised at is the fact that we do know how viruses behave, that there are actually no cure, so to speak, for viruses. What you do is to reduce the replication. And based on the work we did with National Institute of Health, we proved convincingly that the virus can be stopped by using some product that grow here in Nigeria. We tested several, but 3 of them were very active. We isolated the pure compound from them, and it's the pure compound that we patented. But what is also interesting that we also already have products from it that have been licensed by NAFDAC. So all we needed to do was, while we are waiting for the new drug to be developed as a drug that will continue using the phytomedicine, which is readily available, which we already have NAFDAC number. So we are totally surprised that the Nigerians believed that it was not possible, that something that was new, so to speak, that how can Professor Wu and others say that they have a treatment for it? The answer is that it is science. Science is based on facts, and nobody has been able to be able to dispute our data. And the data is that the pure compound from that one of the plants called Andrographis, 7,145 patients were tested in China of all places, because it is a plant that also grows in India. So what we did, what we contributed to science, is to isolate the pure compound. But whether the plant is well known, is well known. We have a product called IHP Detox Tea. I can actually bring the packet if I actually had actually thought that about that earlier, to show you that it is sold in pharmacies and so on. All we are trying to do is to repurpose it for a new issue. As a pharmacognosist, I was interested in developing a new drug. So that process is still on. We are planning to have clinical trials. So the new drug will still be there as an antiviral agent. It is active against several viruses, not just the coronavirus too. So it is a situation that we have in our hand, and I'm glad that Madagascar and the other African countries are using what they have to treat to solve a problem we have. I'm glad that they did that, and so many other people are coming out with claims and so on. Yes, they should be verified, so you shouldn't just dismiss them outrightly like that. Luckily, again, the other point I want to make, since I'm not hearing you very well, is the fact that we have some innate advantages over others. First of all, what we eat is more nutritious and also imbibes us with a lot of immune enhancing these qualities than the West. Secondly, our very humid tropical environment also makes us survive easier in flu season. In the West, even when there is no coronavirus, they die during flu season. So we shouldn't, because our neighbor is there, want to also die with them. The death that we're having in Africa and Nigeria is unnecessary, avoidable, and treatable. That is the whole issue. The fact that they say it's global doesn't mean that we must be so feel inferior in everything that we believe we cannot help ourselves, that except the white man said there is a treatment, then there's a treatment. It is either we have the vaccine or have the drug, and we chose to have the drug. That's the area that we can contribute to the world, and I'm glad that Nigerians are seeing that it is treatable. Interestingly, one of the governors gave us some lead when he said that he used black seed oil and some other herbs to treat himself. There's nothing laughable about it, because black seed oil is an antiviral agent. So all he did, what I used to, and all that is necessary is now for people to be able to apply that properly. Secondly, some people also say they use dogoyaro. Dogoyaro also contains some antiviral agents. So these things are commonsensical. And so when people then start doubting them, to me, it's self-doubt when people don't have confidence in themselves. And that is the bigger problem. It's nothing to do whether Professor Wu is supported or not supported. The key thing that we lack confidence in ourselves, and that is what is undermining most things that we do. I saw a picture in Ghana. They are making PPEs, the personal protection equipment that are made locally. So it's nothing to do. Yes, the issue we are talking about is very important, but this is a lesson. This is a bring home point here, that with all our money, with everything that we have, with all our oil, our biggest problem is lack of self-worth.
Yeah, Prof, we've had your fame about some of the things you have done, but my little worry here is this. This virus, every time at every turn, people say it's an illness, a disease. And I thought to myself, if a virus brings out symptoms of pneumonia, brings out symptoms of fever, and then brings out symptoms of influenza, could you effectively call this virus, the coronavirus, a disease? Could you effectively call it that?
Can you try calling me back again? Let's see whether it's better.
All right.
Please.
I think
I can't hear you at all.
We've gotten the message there. Professor was able to do some follow-up himself with the first 987 minutes, but the bottom line is that he has corroborated what Babajide said, that look, it's possible. This is not as complex as what we think. That we can also do with some homegrown things can also come out from. We can also adopt it.
Yeah, personally, I am not a pro-vaccine person. I've always thought of alternative therapy, and which is exactly what the prof has talked about. So, if we can get a cure, why a vaccine? Do we really need a vaccine if there is a cure? Okay. Because what we see are symptoms of normal illnesses we have on normal days that this virus creates.
Babajide, we are still in the business of talking about palliatives because this coronavirus is not something that people. I don't envisage a situation. The Minister of State for Education yesterday said that the schools will not be opening in a hurry. Now, as the number of the confirmed cases of COVID-19 continues to rise, so must distribution of palliative materials to cushion the effects on the people, especially the most vulnerable. The Deputy Senate President, Senator Ovie Omoagege, is leading by example in this regard in his constituency. The Delta Central Senator is intensifying distribution of palliative items to most vulnerable in his constituencies. Others, like Senator Abiodun Olujimi and Okpeyemi Bamidele from Ekiti States, are also providing succor to their constituents. Even the monarchs like Oni of Ife, you know, helping communities with protective items like fumigators. Let's talk about Deputy Senate President. I think it's starting Delta Central Senatorial District. Babajide?
Yes. He's gone around his constituency, giving money to the needy. As you can see in those pictures, he's not distributing rice and the rest.
Money?
Yes, money, 5,000 to each of them. 5,000. And the people are very old. As you can see now, these are very old people. You know, the Deputy Senate President does not care whether you are from the APC or you are from the PDP or you are from the GMPP. Once you are in his constituency and you are among the vulnerable, you get that cash gift. And he's already spent almost 100 million doing this.
These are
yes. You can see they are singing, they are jubilating because they never expected that this would come, and it's coming, and they have every reason to be happy. Some of them, they just see them on the road, and then they give them the money. So this is what...
Babajide, it will go a long way. Look at these women. It will go a long way. This kind of cash.
The poor, like, the poorest of the poor.
5,000
Look at this woman now. This woman was not expecting that...
Just accost you on the road and...
come away. Yes, and then they just give her the money. You will see them praying in Urobo language and praying for the senator. This is what we expect from our lawmakers. You see? Not agree.
Senator Ovie Omoagege.
Yeah, that is the thing. That's the thing.
Just bringing smiles to people that are in dear need.
When you do not expect it. There was a woman when they walked into her house. She started saying, no, please, I don't want police, because it came to her as a surprise.
How will you come and dash me money?
Yes, when I wasn't expecting it. Just you want to give me money, you know? It came as a surprise to her.
A kind of palliative that Nigerians are expecting from the federal government of Nigeria right now. So, you know...
Ashwaj Bola Ahmed Tinubu has suggested that through the BVN, we can identify the poorest of the poor amongst our people who are bank account holders. That the federal government should send money to those accounts. Because the truth is, we may give people bags of rice, but they also need money to cook the stew.
Money?
Yes, to cook the stew, to eat the rice. So this is the thing. You know?
They can even decide how they are going to, allocate this money that to the best of their this thing. Solomon.
Yeah, I'd hope to see things like this. This is where our political leaders will be a bit more responsive. We've seen a couple of examples. We've seen some of them lead the way and show examples. We still need more of them to come up to the public sphere, to come up to the public space and support the people at this time. People have had to stay home for so long, and not a lot of people can, go on and on. Even when we begin to reopen, it's going to be gradual, it's going to be phased. Some people will still be at home over a period of time, and some people will still need help over this period of time. We'll be doing the gradual and phased, reopening. So I think that our political leaders then need to step up more. Apart from doing these things individually, then they need to sit down and then talk about how we could, make it the way the APC leader has just talked about it. A strategy, a mechanism to distribute.
That happened in Delta Central. Yes. Now going to Ekiti now, the Jide's adopted senator, Ekiti Ekiti South Senatorial District, Senator Abiodun Olujimi.
Why is he adopting
very
Ekiti?
close by. Once you just
very
leave.
Close by.
Yes, it's a spitting distance from my village. The truth is, I'm from Ekiti now. Just in case you didn't know.
Okay.
So you know now. So
Omu Ekiti.
That's the adopted.
So Ekiti South Senatorial District, Abiodun Olujimi.
People don't know. People think I'm joking. I met Governor Kolade-Otitoju on this matter during the birthday of Mama Shagaya.
Yeah.
When she clocked 60.
Bola
Shagaya. I met the governor of my adopted state, and we discussed this issue. So
I am from Lagos.
I've made up my mind. Let's not now. My senator Abiodun Olujimi, he's showing the way. This is the way to do it. That's what she's doing. She's always been a kind woman.
Ekiti South.
Yes, and then
Ekiti Central.
Former NANS president.
Yes.
The cerebral
from
senator.
Inyi Ekiti.
Yes, he's from Inyi. The cerebral senator, former commissioner in Lagos State, is doing well as well. We will continue to praise the lawmakers and the politicians who have considerable means, who are helping our people, because we challenge them to do it, and we are seeing signs.
I'm happy today with what we've seen.
We are seeing signs that they are beginning to do it.
We've seen Olujimi, we've seen
I talked about Senator Abukari,
Yes.
After I said it on the program that, look, what are the senators and House of Reps members in Borno State doing? When the House of Assembly members, 28 of them, donated their March and April salaries. And Senator Abukari went ahead, donated 30 million to the task force. And then we had a conversation after that. I said, thank you, Senator, for what you have done. We need more of that. We
have some people that they've done their own. It wasn't,
elaborate enough.
Like you can do it again.
You can do it again.
You still have,
if you are one of those sharing just one derica of rice to people,
or one loaf of
you
bread,
should know that one is shameful. Go back and do something substantial. If you are giving one loaf of bread per household, you should know that is shameful. Go back and do something that
challenge
people
you the way you are challenging, the way we've seen from the Deputy Senate President now.
Yes, how it is done.
Going to the needy and giving them 5,000 naira. Just take from that money.
Thank you.
You have the money. It is there.
Yeah, you have deep pockets. So everybody knows that you have deep pockets.
It's there. So stop giving them a loaf of bread.
Give them something better.
They
will appreciate it. They will appreciate it. Senator Omar Agege, we are deeply appreciative of the steps that you have taken. In fact,
this is good.
Our friends who work with him, he sent them, stay there. And they've been doing this for weeks now. It's not easy to reach all of these people. It's serious hard work. Yes, now it's serious hard work. Do you know the videos? There are so many. It's serious hard work to reach all those communities. You know? So we thank the senator for his labor of love, and God will bless him.
Yes, so this magnanimity is very, very commendable. I want to thank you, Solomon Ajuziogu, for being part of the team today.
Yes.
And Bikio, we always do it.
And we have to beg God.
Yes, sir.
To help us defeat
COVID-19.
You know, our friend, Senator Dino Melaye, composed a song.
Okay.
He said, Ba corona we nínú ayé wa, Jésù Olúwa náà wá agbára ìyanu rẹ̀. Ba corona we we are begging God. At this stage, it's God that we can beg.
Because
the way it is spreading, it appears that we need divine intervention.
Divine intervention.
So that song that Dino composed is really useful.
And that's our offering today. Join us tomorrow for another episode of the program. You can watch Journalist Hangouts on our platforms showing on the screen. We're on YouTube, youtube.com/TVC News Nigeria. Our feedback channel is Journalist Hangout at tvcnews.tv. I'm Ayodele Ozugbakun. Stay at home and stay safe, please.